You're listening to Conferences Online Allergy at Children's Mercy Hospital in Kansas City, Missouri. Today is December 19th, 2025. We will be doing our fellows lectures, and today Dr. Manali Shah will be presenting Journal Club discussing eosinophilic esophagitis. Dr. Shah is an Allergy and Immunology Fellow at Children's Mercy Hospital.
I'm doing Journal Club today. It's a little bit of a denser article, so I apologize. It's actually one that Cody had kind of mentioned as well when he was talking about some of the high yield things he learned from the literature review at college. And I'm on a food allergy elective, so I've been kind of seeing this. But yeah, we're talking about EoE today. This was an article that came out, it's been almost a year now, but talking about 1 food versus 4 food elimination diet, and it is a randomized trial. So being on this food allergy elective, we had a multidisciplinary clinic with GI and then saw all EoE patients. So I just wanted to bring a little bit of clinic, real life patients to this journal talk. So just a few cases I want to kind of go through, and then I'll kind of circle back at the end. But one of them is a 10-year-old female, had symptoms of abdominal pain, recurrent vomiting, reflux, had an EGD that showed 17 EOs in the distal esophagus. She was started on a high-dose PPI. She also did diet elimination at the same time with the PPI, and the repeat EGD after therapy was normal with no more EOs. Just kind of doing a weirder diet elimination, but they're deciding to avoid milk, egg, and wheat. The second patient we saw was an 8-year-old male, diagnosed with EoE. He was on standard dose PPI. He was avoiding milk as well. His initial EGD showed more 50 EOs in the distal esophagus, and then even with repeat EGD, maybe some improvement, but still had 15 EOs in the mid-esophagus, 11 EOs in the distal esophagus. And then this last one we saw was an 8-year-old who was actually seen in allergy clinic first for a true milk allergy, wanted to start OIT, but had symptoms of EoE, so Dr. Pandya referred to GI, did an EGD, and of course has EoE. He's had about 3 accidental exposures to milk with anaphylaxis symptom requiring ER visits. So yeah, we'll kind of circle back to these, but just wanted to bring some real life to this. So EoE we know is a chronic immune-mediated disease marked by eosinophilic infiltration in the esophagus. Symptoms can vary, but nausea, vomiting, reflux, dysphagia. For children, we think more about kind of the recurrent vomiting. Adults, it can commonly present with food impaction as well. Food elimination can be an effective therapy, but these food elimination diets do impact quality of life, and how to counsel your patients on which one to choose is a discussion to be had. So that's why I think this article is helpful. So what this study looked at, it was a randomized trial. It looked at 1 food elimination, which is milk, versus a 4 food elimination, which is milk, wheat, egg, and soy. And it looked at histologic response, endoscopic response, molecular response, which was gene expression, and then also patient-reported endpoints as well. So I'll kind of abbreviate these 1 food and 4 food elimination diets with these acronyms from here on out. So this, again, was a prospective non-blinded randomized trial. It was conducted at over 10 sites in the USA. It was pediatric patients, so it was age 6 to 17 years old who had histologically active EoE defined by greater than 15 EOs per high power field, did not respond to standard PPI therapy, and they still had symptoms within the last month. They had a 12-week screening period, and each patient got an EGD prior to being enrolled. Then they were then randomized to either the 1 food elimination or the 4 food elimination. They did the elimination diets for 12 weeks while still being on that standard PPI, and then underwent a repeat EGD after the 12 weeks. And that was phase 1 of the trial. Participants who had histologic resolution, which was defined as less than 15 EOs per high power field, completed the study, but people who didn't have histologic resolution, they went on to phase 2. So what phase 2 was, if you had no response in the 1 food elimination diet, then you were assigned to 4 food elimination. If you had no response in the 4 food elimination, then you were assigned to a 12-week swallow topical steroid treatment. And then again, in the phase 2 treatment, they both underwent a final EGD, and the swallowed steroid they gave was actually fluticasone, HFA, and were told to swallow it. It was not budesonide in this trial. So the way they kind of looked at if participants adhered to their diet was the use of dietitians. They were given written education materials for what to avoid in their elimination diets. Compliance was then measured by a questionnaire. So patients completed 3-day food diaries, and they were asked if they did not eat the eliminated food at all or less than once a week over 10 of the 12 weeks, and that was considered good compliance. So what were they measuring? So the primary endpoint was this thing called a PEESS score. What that stands for is a pediatric eosinophilic esophagitis symptom score, which actually is a validated questionnaire for EoE patients. And we'll kind of go into what that score measures. But basically they were looking at that score at baseline, and then after 12 weeks of diet elimination, they did the score again to see if there was an improvement. Some secondary endpoints we'll talk about. They looked at histologic remission with the repeat EGD after diet elimination, and then other like endoscopic biomarker quality of life responses. And lastly, and we'll discuss some predictive factors for those who achieved histologic remission compared to those who did not. So what that score is, that pediatric eosinophilic esophagitis symptom score, again, it's a questionnaire that's given to children ages 2 to 18 that measures how often and how severe they experience symptoms. It looks at symptoms of dysphagia, GERD, nausea, vomiting, and pain. It is scored 0 to 100, and a higher score indicates more severe symptoms. Typically, this is parent reported, but if the child is 8 years or above, the child themselves can report it. So what the kind of study included and how many people were involved. So there were 63 participants that were randomized, 38 in the 1 food elimination diet, 25 in the 4 food elimination diet, 51 completed phase 1 of the study. So there were some people who withdrew. And then people who went on into phase 2 as well. There were still some people who withdrew in phase 2. So we'll kind of go through, I think it's just easier to look at with a chart. So again, 63 total patients that were randomized to either 1 food or a 4 food elimination diet. 34 out of the 38 completed a 1 food elimination diet. 17 out of 25 completed a 4 food elimination diet. Those who did not respond via like histologic response, meaning they still had greater than 15 EOs per high power field on the EGD, went on to phase 2. In that 4 food elimination diet, 8 out of 19 completed and got the swallowed glucocorticoid. And then 8 out of 19 went on to complete a 4 food elimination diet if they didn't respond to the 1 food elimination, and then 4 out of 10 in the 4 food elimination diet got a swallowed glucocorticoid. So looking at that first primary endpoint, that PEESS score, so there actually was a significant difference in this in the 1 food elimination diet compared to the 4 food. So the mean change in the parent reported PEESS score was greater in the 4 food elimination diet than the 1 food, meaning that there was a greater improvement when patients were doing a 4 food elimination diet, and that p-value was 0.04. When you kind of look at the subscores of that PEESS score, the most significant was in the GERD symptoms and then the nausea and vomiting symptoms. So the dysphagia, abdominal pain symptoms were not as significant. So this is, again, I don't like these tables, but I think it's like kind of the best way to look at it. So just focusing on the left here. So these are parent reported scores for the pediatric eosinophilic esophagitis symptom score. In this top column, if you look at the total score, so again, there was a higher adjusted mean for the 4 food elimination diet of 25 compared to the 1 food elimination diet of 14, meaning there was a 25-point improvement from baseline to 12 weeks, and then a 14.5 improvement from baseline to 12 weeks in the 1 food elimination diet, and that was statistically significant. And again, looking at these subscores of which it was the GERD and the nausea, vomiting, which is I highlighted here. The dysphagia and the pain was not statistically significant. I compare that to the right side of this table here in the child self-reported PEESS scores, meaning that the child can fill out the questionnaire themselves. There was no statistically significant difference in the total PEESS score or any of the subscores either. Again, it's kind of hard to say a child, you have an 8-year-old maybe reporting these symptoms, but that was the one statistically significant difference. Looking at that histological response, so pre and post treatment EGD, so That was defined again as less than 15 EOs per high power field, and complete remission was defined as less than 1 EO per high power field. So histologic response occurred in 41% of patients in the 4-food elimination diet, and then 44% of patients in the 1-food elimination diet. And that was not statistically significantly different between the two for histologic response. The complete remission, so when you have less than 1 EOs per high power field, was the rates were again similar between both groups: 18% in 4-food elimination, 21% in 4-food elimination. So again, this is just that chart that they have of the treatment difference from the 1-food and the 4-food elimination diet and the number of patients who had histologic remission. And again, it was not statistically different between either elimination diet group. I thought this table was kind of helpful. Just to walk through it a little bit, what it's looking at is the eosinophil count, the peak eosinophil count, whether that's in the mid or distal esophagus, and the circles to the left kind of show the baseline, and then the post EGD at week 12 after therapy show how they've kind of responded. I think there's like one interesting trend I noticed by looking at this graph, which is why I wanted to bring it up, is the ones who kind of had a lower eosinophil count at baseline prior to therapy are kind of the ones who also seem to have more of a histologic response. Like if you can see some of these, I'm not sure if you can see my mouse, but some of these lower ones closer to that 15, maybe to 20 eosinophils seem to have kind of come down more dramatically than the other ones at week 12 in both the 1 and the 4-food elimination diet. So just like looking at the histology and symptoms, so I guess what the study was also looking at was, did the in the patients who did have a histologic response, meaning that they had less than 15 EOs, did that correlate with their change in their symptom score of what they reported? And they actually found that there was not a correlation in that, which we kind of know. When I was rotating that EoE clinic, GI was also saying that the number of EOs in the esophagus don't always correlate with severity of symptoms. Another thing the study looked at was endoscopic response. And a lot of scoring systems here, but they looked at something called eosinophilic esophagitis reference score. This is a standardized endoscopic scoring system for EoE, and it looks at 5 things. So picture A right here looks at edema. Picture B here also looks at rings, so we can see those circle rings around here. Picture C here is looking at furrows, so those things coming down the esophagus. Looks at exudates as well, and then strictures. You can see kind of this narrowing here, and then F is just a normal esophagus, healthy looking. So they also looked at that endoscopic response for those 5 visual findings. And after 12 weeks of diet therapy, they found that the endoscopic response in the 4-food elimination diet improved by 1 point pre and post EGD, and improved by 0.58 points in the 1-food elimination diet. But again, that was not statistically significant in the endoscopic response between both groups. Another thing we looked at, those biomarkers I was talking about, is like the gene expression of some genes associated with EoE. So in those who did have a histologic response in either the 1-food or the 4-food elimination diet, the gene signature changes were similar between both groups. And if they did not have a histologic response in either the 1-food or the 4-food elimination diet, the gene expression was still similar and within baseline measures. The only thing that they did find was that we looked at, again, the EoE diagnostic panel, which comprises of a certain number of genes, and they measured it in those who did and did not have a histologic response between both groups, and that was kind of what was improved. So they found that the EoE diagnostic panel was improved in those who responded compared to those who did not respond. This is kind of, again, a busy slide, but I'm not going to go through all of these genes and everything that they looked at and tested for. But on the left here, like this color map, it's called a heat map, I learned. You can kind of see on the left, there's non-responders. They compare baseline to the 1-food, 4-food elimination diet. And on the right is the responders. So blue indicates decreased expression, and red indicates increased expression of that gene they were testing. So you can see in the non-responder, there's kind of more of that red color for certain genes, and then you don't see that as much of the red in the responders. And that's, again, what they had noticed, that the diagnostic panel was improved in the responders compared to the non-responders. This gene map on the right here, kind of similar. Again, I'm not going to get into all these different genes that they had tested and what they're looking at, but the circles that are marked blue indicates genes that were significantly improved, and then red indicates those that were significantly worsened. And again, you can see in the responder group, there's more blue genes compared to the non-responder. There's more red genes, meaning that the genes had worsened in the non-responders. With the non-responders and then the one food versus the four food, again, the gene expression was the same, and the genes in the responders for the one food or the four food were the same, regardless of which diet you were on. The last thing that they looked at was, again, the quality of life. So they just used, again, different validated questionnaires. So the pediatric quality of life inventory, there was a 3.0 and a 4.0 score. And I guess a 3.0, it's kind of more directly related to kind of EoE symptoms, whereas the 4.0 is more like of a generic type scale. And they found no difference in either the parent proxy or the child self-reported quality of life scores. That's kind of, again, represented here. On the top one, we have the PEDS quality of life, EoE. The total score on the right hand is the parent proxy. On the left hand, left hand is parent proxy, right hand is child self-reported. No significant difference in the quality of life scores for either parent-reported or child-reported in either of the quality of life questionnaires. The last thing I want to talk about is like the phase 2 study results. Those are the ones who did not have a histologic response and then moved on to either the one food elimination, moved on to the 4 food elimination diet for 12 weeks. And then the 4 food elimination diet got the swallowed glucocorticoid. However, a lot of the patients who went into phase 2 did withdraw, either because the diet was too hard or they were having side effects from the swallowed glucocorticoid. But there was one of 8 participants on the 4 food elimination diet, and 50% of the patients who received swallowed glucocorticoid did achieve histologic remission. But these numbers, again, are pretty small because of the how many people have withdrawn. Looking at the predictive factors, so they were trying to see, can we predict who would respond to having a histologic response based on like predetermined things. So age, sex, race, BMI did not have any effect on histologic remission. The biggest thing was the eosinophil count at baseline was a predictive risk factor for remission. So the lower your peak count was, the peak count was at baseline, the higher the chance that they experience remission at the end of the treatment, which is kind of what that graph had shown earlier too. They did do some allergy testing in the study as well. They did skin prick testing and some patch testing as well. So the skin prick testing to milk was done to the 1 food elimination diet, and then there was skin prick testing done to milk, egg, wheat, and soy in the 4 food elimination diet. But it was in those who had a histologic response and those did not, there was no differences whether that a positive or negative test. 45 participants were administered milk patch testing, and of those 45, 3 had a positive reaction. And none of the participants who had a positive patch test were in histologic remission after diet therapy. So even though they had a positive test to milk, eliminated milk in their diet, they still didn't have a histologic remission. They also looked at some serum blood work too. So levels of milk IgG4 and IgE antibodies were assessed to see if there were associated all with histologic remission in the 1 food elimination diet, so only to milk. They looked at IgG4 levels to different components of the milk, so BOS-D4, D5, D8, and they found that the baseline levels to these components were higher in those who had a response to the milk elimination diet compared to those who didn't have a response. Specifically, it was statistically significant for BOS-D5. They also looked at different ratios. So the ratio of IgG4 to IgE to cow's milk was significantly higher at baseline in those who had a response to the 1 food elimination diet compared to those who didn't have a response to the 1 food elimination diet. So it's kind of just like a summary of their trial. Again, we looked at pediatric patients, small number of 63 that were randomized to either milk elimination or milk, egg, wheat, and soy. They did that for 12 weeks with diet therapy, and they looked at the symptom score, histology score, psychosocial score, and then the transcriptome, which was the gene expression. On the bottom of this chart, they talk about these symptoms. So the only significant difference was in the parent report PEESS symptom score. There was a significant difference that the 4-food elimination diet had a greater improvement than the 1-food elimination, but in the child report, there was no difference. No difference in histologic remission, no difference in esophageal histology, and then no difference in any of the psychosocial or the quality of life questionnaires. So overall, just like discussion of this article, I thought it was pretty well done. I mean, I think whenever you have a randomized study that involves multi-sites, it's a pretty like a robust thing. However, I also did like that it looked at pediatric patients. A lot of the journal articles I have done for Journal Club typically look at adults. So I thought that was another strength. And I thought that it was also a strength that they looked at many different things, like looking at like the histology response and the number of EOs, symptom response, quality of life, endoscopic findings, even like the gene transcription. However, the study did have a pretty low number of participants. Only 60 were enrolled, and then there was still a pretty significant number of patients who withdraw, either like because the diet was too hard. They talked about the caloric intake and the 4-food elimination diet wasn't enough, that patients had actually lost weight. So yeah, there was a decent amount of withdrawal of the patients in both phase 1 and phase 2. Just to kind of go back to those real life cases and what like we ended up doing in clinic. So for the one who was avoiding the milk, egg, and wheat, we didn't really understand like her diet and since her like her elimination diet and why they chose that. But since her repeat EGD was normal, we discussed kind of reintroducing egg into her diet and then potentially if she wanted to add wheat back into that. So family was going to start with at least reintroducing the egg, and then they were going to work on the wheat after, and they still wanted to avoid milk. This second one, so this is the one who had a milk elimination, but on the EGD, even after doing milk elimination diet for about 3 months, it was like, at least GI was saying like there not a significant difference in the number of EOs that they saw. The family did want to reintroduce milk into the diet after discussion, but they refused to do so without testing. So Dr. Pandya offered some patch testing to them, which I saw this week in clinic with her, and it was negative at 48 and 72 hours. So family is going to introduce milk again and continue with PPI, and they might consider either oral steroid or Dupixent with GI. And the last case, the one who had a true milk allergy, wanted to start the OIT but had anaphylaxis. We're actually starting omalizumab for milk allergy just because the risks of the milk allergy are kind of outweighing the risks of the EoE at this point, since it's having so many ER visits. So the data for omalizumab and EoE, at least when talking to GI and Dr. Pandya, is there, but not as robust, obviously, as like dupilumab. But GI and we agree that the milk allergy anaphylaxis symptoms are more important. So after starting omalizumab, they're already doing a PPI and then considering an oral steroid after that to treat the EoE. So just some kind of takeaways from this article, kind of what I've like learned in clinic and seeing EoE so far is food elimination diet, it can be a therapy used for EoE, but it's a discussion to be had with patients, kind of seeing what fits best for their lifestyle. Based on this randomized trial, at least 1-food elimination diet may be just as effective compared to a 4-food elimination diet, at least in histologic response and quality of life. And that's something you can counsel to the family because, I mean, we all know these 4-food or 6-food elimination diets are super hard to follow, impact quality of life. Can also consider people who might benefit from diet elimination, considering like what their eosinophil counts are, if you decide to do any allergy testing, things like that. And again, just using shared decision making with the patient, decide what the best fit for them is, whether it's a combination of meds and diet elimination and which diet elimination they want to do.